Neste vídeo, informaremos sobre a história da medicina, como tudo isso iniciou no ano de 1935 nos Estados Unidos. Tenham um bom vídeo através deste documentário, em especial a história da medicina.
The story of man's fight against disease begins with the early history of primitive man. There were many kinds of witch doctors and medicine men. The long development of medical practice has some of its origins in Egypt, 5,000 years ago. The Greek physician was a link between the sick and the gods whose laws had been broken. For the story of great ideas in the history of medicine, stay tuned to Science in Action.
Ancient physicians had a method of treating goiter with seaweed long before we recognized the effect of iodine on the thyroid gland. Extract of toad venom was given to heart patients centuries before the isolation of digitalis. Now, the so-called backward peoples used mildewed bread for festering wounds long before the civilized world knew anything about penicillin. The story of medicine can be said to begin with the history of disease, and disease is as old as life itself. To demonstrate some of the great ideas in medicine, we've invited as our guest on Science in Action a specialist in the study of medical history. She holds the first doctorate in this field, awarded by Johns Hopkins University, and is now a professor of the history of medicine at the University of Chicago. It's my pleasure to welcome to Science in Action Dr. Ilse Wieth. Ilse, how have you been?
Thank you.
You know, I've been reading in your new book, just came off the press very recently, Great Ideas in the History of Surgery, along with your colleague, Dr. Zimmerman, and you know, I begin to get the idea in reading why it is so important for us to understand what's happened in the past in medical history.
It is not only important, but it also shows man's dramatic struggle to gain mastery over disease. And it is about the most dramatic story of all the fields of history. It is of importance also for us to study the history of medicine of the various other civilizations. It is of practical importance because if we want to bring Western medicine, our modern medicine, to underprivileged peoples all over the world, we must understand their medical systems in order to blend ours with their beliefs and to gain a good result.
In other words, we have to be fully aware of the implications of their own cultures before we can work with them medically.
Yes, Earl, that is so.
Well, I would like to ask you a little bit about the actual point, the starting point for the history of medicine. And to do that, let's go over to this next section where we have some artifacts on the wall here, which I think will help with it.
Among the earliest finds that tell us about human operations on humans, we see these skulls of various ages in antiquity, which were found all over the world in widely different regions. These show an operation which is called trephining or trepanation, and they were performed for a variety of diseases, and in all probability also for unbearable headache. That these operations were frequently successful, in even the absence of anesthesia or antisepsis, can be shown on this skull, which shows a hole which had healed after the operation because you see scar tissue has formed around the bone. Actually, this operation was sometimes performed more than once on the same patient, and there are skulls that show 4 or 5 of these trepanning holes, all of which healed and the patient survived this operation.
Recovery after the operation.
They recovered from the operation, yes.
Now, in our discussions earlier today, you pointed out some of the significance of early finds, for example, bones coming from Java man, showing tumors and things of this kind.
Yes, this is a very good example of these bone tumors. Then other examples can be found of Egyptian mummies, which are shown with fractures of their bones accompanied by splints, which show that apparently an Egyptian man could reduce fractures and bring them towards healing.
Yes.
And also there are indications that tuberculosis existed in early man and that spinal tuberculosis was not an uncommon occurrence.
Ilse, quite often in the past on Science in Action, we have found information in the pictographs, the paintings on the walls in the caves in Spain and in France. Now, do you find information helpful in medical history in these same caves?
Yes, actually the first picture of a physician came from a cave in the Pyrenees, and it dates back about 17,000 years. It shows a medicine man who was clothed in deerskin with antlers in order to enhance his awesomeness, and he was a healer in all probability as well as a religious figure.
Now, how did this relationship between religion and medicine, how did it all start?
In all probability, this started because man assumed that the deities to whom he prayed were also the ones that sent disease, or the superhuman powers, or spirits, or demons. And the medicine man was thought to be a good mediator between these figures and between these superhuman personalities and the patient. And he prayed as well as medicated.
Well, now we know that the Egyptian civilization has provided us with all kinds of information about things that have happened in the past, as well indicated by these hieroglyphs that we have here. Now, what kinds of medical information do we have from the Egyptians?
Well, the Egyptians probably provided us even with the first reproduction of polio, which is shown on this relief which appeared on an Egyptian temple. But the Egyptians gave us more than paintings and carvings and sculptures. They also gave us manuscripts. They gave us in the form of papyri. And to my mind, the most exciting of all the papyri is the Edwin Smith surgical papyrus, which was discovered by Edwin Smith in the 19th century and translated into English by Breasted in 1930.
This is different on this side from what we find over here.
This is the writing as it was found, and this is a facsimile, a reproduction of the papyrus itself, whereas this is a transliteration. It's a transcription into hieroglyphics from the hieratic writing.
And then from the hieroglyphics then comes
Breasted made
the
the
actual translation. Well, now, did these early Egyptians, did they make use of medicines and things like that in their work?
They did make use of medicines, although this papyrus is predominantly surgical, and the medications recommended are largely for after treatment, after surgical operations had been performed. But they did make wide use of medicine. Some of them were quite rational.
Is there any special case in here that you like better than the others?
My favorite case is the called Case 25, and is the reduction of a dislocated mandible or dislocated jaw. And I like it particularly well because it can be so easily demonstrated. I think I would like to demonstrate on you, although your jaw is not dislocated. I should be putting my thumbs inside your mouth, but it would be done like this. And this is actually the way mandibles or jaws are still adjusted when they're dislocated now.
In other words, the Egyptians started it, and we're still following the same
Yes,
line,
and in
the same
between
technique.